I think what I would like to do is to take my time with you this morning and talk about how and why it is that a public option will be able to reduce costs and compete effectively, even though the public option that was designed in our help committee doesn't get government subsidy. It has to stand on its own independently, state by state, and compete in the private insurance market. So how is it that it is going to be able to effectively reduce cost? There are three ways in which it can readily begin to do that. The first is that it is not necessary for a public option to extract profit out of the market. In my home state of Rhode Island, just a few years ago, United Health Plan, this is a state of 1 million people, mind you, and it was a state in which United Health Plan at the time only had a 16% market share. Out of Rhode Island, in 1 year, that one company extracted or tried to extract $37 million in profits to export back to its headquarters. $37 million put back into a 16% market share in Rhode Island can mean a great difference in improvement in the quality of care and in cost for those folks. And that's just the profit element. We are now in an insurance industry that is engaged in an arms race with the private sector providers and hospitals. Administrative cost on the side of the insurance industry has increased more than 100% in this decade. More than 100%. And they're using that administrative cost to figure out ways to make it more complicated for those doctors and for those hospitals to get treatment authorized and to get payment made. So the hospitals and the providers have to build their own infrastructure to fight the claims denial apparatus of the insurance industry. Between the two of them, it is enormous. The insurance side alone is 10 to 15% of cost. And that doesn't count the shadow of cost that it casts into the provider community who have to reciprocate. The third way in which the public option will make a big difference is that it can lead the change in the business model that is necessary to turn our healthcare situation around. Improving the quality of care in ways that lower cost. Improving our investment in prevention in ways that lower cost. Improving our investment in health information technology in ways that lower cost. Improving the transparency of the value and the results of care so that people can make better decisions at lower cost, and payment reform so that providers aren't paid for more procedures but for better outcomes are the 5 tools that we will use to turn this around. The target is a big one. President Obama's own Council on Economic Advisors has recently published a report saying that excess cost in the healthcare system in America is $700 billion a year. If we could only, by improving the business model, get a little bit of that back, it would be an enormous savings and make a big difference. The question ultimately is, can we trust the private insurance industry exclusively to take advantage of this moment and turn the direction of healthcare in those directions? My experience with them is that the answer is no. The track record that they have shown us demonstrates that the answer is no, and I think the public option is critical to taking advantage of all of the other measures that we're building into this healthcare reform so that we can turn this healthcare system around before it creates economic wreckage in this country. Thank you.